Is this you? Do you struggle to get out of bed in the morning? Do you have a lot of pain and stiffness in your lower back that makes getting up from a laying down position a struggle for you? Do you find sometimes once you get up to the sitting position, then you go to stand up and you feel like you're 90 years old and it takes you, a few steps to even get up and get going and get mobile? Then stay tuned to this video because I'm going to show you some tips and tricks to help you get out of bed with much more ease, much less pain, much less stiffness, and start your day off with increased mobility and increased function right from the get-go. Hi, I'm Dr. Scott McCrimmon, and I'm one of the chiropractors here at Caledonese Family Chiropractic. Pain and stiffness in the lower back when you first wake up in the morning is a problem that we see quite often in our office. It's very common, but that doesn't mean it's normal. This pain and stiffness can come from a variety of reasons. It could be from arthritic or degenerative disc problems in your lower back, other types of disc injuries such as bulges or herniations. It can be from muscle tightness or stiffness, inflammation in your lower back, or even something as simple as the position you're sleeping in or the type of mattress you're using. Those are all going to be topics for a different day, but I'm going to give you some of the strategies that we teach our patients to help them get up with less pain and less stiffness. And as always, a couple of quick reminders. First of all, if you like the information you hear in this video or any of the other videos from our office, be sure to hit that subscribe button below, turn on that notification bell, and give us a like so that you can stay up to date with all the videos that we put out each week from our office from our various practitioners that will help you and your family keep healthy, keep active, and keep pain-free. And as always, any of the information that you hear is for educational purposes only, and it's always best to consult with your healthcare provider to make sure that this advice is best for you and your condition. Okay, so what's the best way to get out of bed in the morning? Well, very common when we first wake up in the morning, the low back muscles can be tight and stiff. So often what we tell patients to do is a couple of really simple, easy stretches that will help loosen things up. So when we first wake up, it's always good to get onto our back. Then, really simple, one leg at a time, we pull our knee towards the shoulder on the same side for about 20 or 30 seconds. Then we move our knee towards the other shoulder for about 20, 30 seconds. Switch legs, 20, 30 seconds to this shoulder, 20, 30 seconds towards the other shoulder. We do that at least once per leg. Some people will do it 2 or 3 times, depending on what their comfort level is and how they're feeling. Now, the biggest mistake I see people make is they wake up in the morning and they just do this. They try and do the big sit up like that, or I'll even see people will throw their legs up and do the big roll and try and fire themselves up that way. Well, any type of sit-up motion puts a lot of stress to your lower back. I'm not a big fan of sit-ups to begin with, and you add some of the lower back trouble. When you do a full sit-up, it puts a lot of compression down on your lower back, especially through those discs. It puts a lot of pressure down there. So there's a much better way to get up than what I call a sit-up. So if we get back on our back here, what we have patients do is once they've done those couple of stretches, is to turn over onto their side, whatever side of the bed you're closest to. And we curl up into a fetal position. Then we take our top hand, push down on the table, and you're gonna lift yourself up with your arm. You can use both hands, and at the same time, your legs are swinging off the front. That takes all of the stress off of your lower back, puts on your arms, and patients find it much, much easier. So I'll show you one more time. From our back, we do our stretches, then really simple. Onto our side, in this fetal position, then we use our arms to push ourselves right up, nice and easy into a seated position. Now that we've made it up, and hopefully our back felt a lot easier doing that, the next trick is how do we get from our sitting position to our standing position? For some people, this is actually quite a challenge in the morning, especially if they have a lot of trouble with their lower back. Most people, when they go to stand up, they tend to lean forward, push through their knees with their hands, and stand up. And there's a lot of bending in our back that way. So again, I'm going to show you from the side here. So we look down at the ground, and a lot of people stand up like this. Okay, I'm exaggerating a little bit, but that's kind of the posture that we see. When you have lower back trouble, that bending can be a challenge. So the tip we teach people, whether it's getting in a bed or even getting in your office chair or your kitchen chair, wherever you're sitting, is I call it getting up with your eyes. And what I mean is, most people when they get up, they look down at the ground. So instead of looking at the ground, what we have people do is look up at the ceiling, hands on your knees, and you push through your heels and you follow your nose straight up to the ceiling. Okay? I'm going to show you from the side here again. So there's the normal way where people lean forward and get up like this. But if we can tilt our head back, look at the ceiling, follow our nose right to the ceiling, you can see there's much less bending in our back. And keeping that back straighter takes a lot of pressure off it and will help you get up quite easy. Now if your bed's nice and high, a lot easier to slide out with keeping your back straight. When you're getting out of a chair or you're getting out of a lower bed, look at the ceiling, chin up, Push through your heels and keep that back nice and straight. It'll take a lot of pressure away. So, in summary, if you're someone who's struggling to get out of bed in the morning, or you know somebody who is, use these tips. Start on your back, pull your knee towards your shoulders, one leg at a time to each shoulder, about 20-30 seconds. Roll onto your side, use your hands. Don't do the big sit up and put all that pressure through your back. Push with your arms, get to a nice seated position. Then when it comes time to stand up, tilt your head up to look at the ceiling and push through your heels. You're gonna make your mornings a lot easier. I certainly hope you find that helpful. As always, explore our other videos. There's a lot of great information from all our practitioners here. Have a wonderful day.